A 50-year-old woman who is non-smoker and non-alcoholic came to your hospital with the complaints of intermittent abdominal pain. Occasionally, she used over-the-counter drugs for osteoarthritis of knee. She works as a telephone operator in an office. Her fasting serum level of gastrin is above the normal limit and rise in response to intravenous secretin. Upper GIT endoscopy shows ulcer in the distal duodenum. The patient's condition is most likely caused by which of the following processes: autoimmune destruction, Helicobacter pylori infection, neoplasm, stress, NSAIDs which she is taking. This patient presented with a distal duodenal ulcer and higher than normal gastrin level that rise in response to secretin administration. This is highly suggestive of Zollinger-Ellison syndrome. This condition is caused by gastrin-secreting tumors, which is also called gastrinoma. These tumors are often malignant and is usually located in the distal duodenum or pancreas. Gastrin causes parietal cell hyperplasia and stimulates the gastric acid secretion, resulting in the development of peptic ulcer and heartburn. Although the most proximal duodenal ulcers are usually caused by H. pylori infection or NSAIDs, ulcers which are found beyond the duodenal bulb are suggestive of Zollinger-Ellison syndrome. Autoimmune gastritis or chronic atrophic gastritis involves the body and the fundus of the stomach, and it spares the antrum of the stomach. The CD4 T-cell mediated parietal cell destruction causes impaired gastric acid and intrinsic factor secretion, resulting in aclerohydria and pernicious anemia. Low acid level stimulates the gastrin level. Low acid level stimulates the gastrin release and causes hypergastrinemia. But secretin administration causes a reduction in the gastrin level. Secretin is a hormone released from the duodenum in response to acid and fat in the small intestine. This hormone also increases the pancreatic bicarbonate secretion and inhibits the release of gastrin from normal gastric G cells. Administration of the exogenous secretin stimulates the gastrin release from the gastrinomas and can be used to differentiate between Zollinger-Ellison syndrome from any other causes of hypergastrinemia. For example, atrophic gastritis-like conditions. Helicobacter pylori infection is mostly associated with chronic antral gastritis, which may lead to a reduction in the somatostatin-producing cells. Lack of inhibition by somatostatin allows the excessive gastrin release, which promotes gastric acid hypersecretion and proximal duodenal ulcer. And in this scenario, the ulcer is in the distal duodenum. Secretin administration normally causes a reduction in the gastrin level in these patients.